Gone are the days when patients were passive recipients of their care. They're making their feelings known by leaving comments on patient feedback websites. Patients can award stars for things like cleanliness, a bit like rating a hotel. But we all know about authors reviewing their own books online. Are these new systems open to the same abuse? Nottinghamshire Healthcare Trust uses the website Patient Opinion. The Trust prides itself on how quickly it responds to patients' comments. However, we've discovered that half of the reviews, more than 100 in total, were posted by staff on behalf of patients. But more troubling than that, the NHS puts these same comments on its own site, but without making clear which ones have been posted by staff.
Your data has already shown that staff in the NHS are reporting data. I mean, that's wrong, but the data they're reporting is skewing the results, and that has to be wrong. So it's making the data that the public sees as almost meaningless.
The NHS has now removed all of the 652 Nottinghamshire reviews. In a statement, Nottinghamshire NHS Trust said, "We acknowledge that postings need to be clearer about who is writing them, and we're working on a solution for this, internally and with Patient Opinion." Patient Opinion told us that it has changed its site to make it clearer when reviews are posted by NHS staff on behalf of patients. We absolutely accept that it must be clear to everyone when a story has been added by staff. We decided to broaden our investigation to see whether the NHS's new patient feedback website, Care Connect, which is being piloted in 18 hospital trusts, is open to the same abuse. We started by going through hundreds of patient reviews. It wasn't long before we grew suspicious about some of the comments. Very impressed with the consultant. The investigations were very thorough and performed so efficiently. So impressed. The doctor was very helpful, lovely staff. And this one just had 5 stars. In order to find out whether NHS staff were posting these reviews, we needed to know the IP addresses. An IP address is like a computer's phone number and postcode. We were suspicious about 9 hospitals. So, through a Freedom of Information request, we got the IP addresses and discovered that NHS computers were being used. 6 of the 100 most recent reviews came from hospital computers. We also found that the reviews posted from NHS computers were more positive, a whole star rating more positive than the other comments on the Care Connect site. It was in the wake of the scandal at Mid Staffordshire Trust that Robert Francis QC called for fundamental change in the NHS.
It was a culture which trumpeted successes and said little about failings.
Relatives were ignored or even reproached.
Our NHS is not safe in their hands.
But 1 year on, not everyone's convinced the NHS has learned.
We've known for a long time that the culture of the NHS is one of staff feeling under pressure to deliver results. And I think this is now a symptom of that, that staff are putting on results that aren't necessarily true, and it's interfering with the results under the marking system or the star rating system that we've got today. And that's the thing that we should be addressing.
Hospital trust budgets are now linked to how well they're rated by patients, who are asked whether they would recommend the hospital to friends and family. Some worry that Care Connect could similarly be linked to payments.
Patients and families think the NHS is going to tell them the truth in all sorts of ways, and it overwhelmingly does struggle hard and does tell them the truth and does try and do it. But if there's an incentive to do little things like, well, I'll just put in this story that looks good, then that actually attacks that fundamental trust between citizen and health service that lies at the core of what is a fantastic service in the NHS.
We don't know for certain why these reviews are being posted from NHS computers. It could just be that NHS staff are proud of the work they're doing. After all the negative publicity they've been getting in recent years, it's hardly surprising that some staff might want to boost the ratings of their hospital. But the problem with all of this is that it undermines that transparency and openness that the NHS now says it values so highly.